My name is Helen Waldab, and I am very excited that you all have joined us for a very special product showcase featuring innovative solutions for competency-based education and nursing education. I'll be your moderator, for this webinar. And before we get started, I'd like to share just a few housekeeping notes with you. If at any point you have any questions, please use the Q&A box. And for any general chat or to share your experiences or any resources, please use the chat box. You will receive a copy of the webinar recording within a day or two. So with that, I'm pleased to pass the mic to our speakers and product experts to kick off this webinar. Thank you again for joining us.
Thanks, Helen. I cannot believe how many people are here. This is so exciting. We are really looking forward to it. And I'm Amy Klein. I'm the head of competency-based education for Laerdal. I'm a nurse and a nurse educator by background. I've been working in simulation for over a decade now. It feels kind of crazy to think that, but I've also previously worked at the National League for Nursing, where I was the manager for educational program innovation, and have consulted with lots of schools on their simulation-based programs and helped to develop simulation-based training in China and India and for some other schools as well. So I'll let my coworker Erin here introduce herself.
Hello, I am Erin Ziegler, and I am also a nurse with pediatrics and community health being my background. And before joining the Laerdal family, I worked in higher education for over 15 years, working anywhere from lab to clinical to classroom and online. And relevant to our topic today, in addition to working in simulation, I also served in a leadership position at a university that utilized CBE framework for a curriculum. And so at Laerdal, I am a SimCapture impact manager, and I support my hospitals and my universities with using their SimCapture platform for managing their operations and curriculum and simulation programs.
Erin, and we're also going to be hearing from Dr. Laura Klenke-Borgmann from the University of Kansas in just a little bit here, and I'll let her introduce herself in just a few moments, but just wanted to orient to the webinar flow today and kind of make sure that we're all on the same page around some of the terms and topics that Laura is going to touch on as well. So today we're really going to focus on understanding some of the different ways that you can incorporate simulation into your curriculum to assist with competency development. We're also going to see how Laerdal solutions can work together to improve learning outcomes. And then we'll discuss the importance of tracking and assessing learners for their ability to demonstrate those competencies that you're hoping to develop through simulation. If you have any questions, put them in the chat. I know we'll have some of our Laerdal friends helping to monitor that since there's so many of you, but we'll try to get through as many as we can. And I'll have you just go to the next slide there, Helen, if you don't mind. Thank you. All right, so it is good to have just a common working definition of competency-based education before we begin, because I know Laura's going to touch on that. So, which organization you look at or which association maybe you're affiliated with can have a little variation on how they define competency-based education. And so we really want to focus on the fact that competency-based education is learner-centered, requires that frequent and varied and scaffolded learning experiences. It weighs heavily on performance-based assessment, so ensuring that you are able to objectively watch how students perform and see how that competency develops over time. And then it also prioritizes this continuous feedback, the need for coaching and using the assessment data that you have on students to help them remediate or refocus where they can improve. And it's really prioritizing what learners can do over that traditional emphasis on what they know or time spent in the classroom, right? It's about the application of knowledge in that outcome-focused, learner-driven environment. So we're going to dive into what does that mean, right? That's a lot of really fun words, but what are some practical strategies that we can employ in our universities and our schools to help have that experience? And one of those, of course, is simulation. And so when we think about simulation, we've used it as a really powerful teaching tool over the past 15, 20 years now, right? It's not brand new to nursing education, but we're thinking of how do we use it in this shift to competency-based education. we're hearing a lot of our universities and schools and sim directors coming to IMSH, coming to Laerdal, saying, you know, as we're shifting to competency-based education, everyone's saying, well, we'll do it in the sim lab. The sim lab can help take care of that. They've always been able to have performance-based assessments. And it is a really critical role because it can serve as that teaching modality and that assessment strategy. But it is just one piece of that shift to competency-based education. It's critical, and we're really going to see an uptick in use, but it's also really important how we leverage the different experiences within simulation-based learning to be sure that we are maximizing that learning outcome. And so we're going to hear from, yep, thank you. Sorry, you got one beat ahead of me. There you go. And so we're going to, before we dive into Laerdal's specific solutions, we're going to hear from Laura Klenke-Borgmann, like I said, from the University of Kansas, and she's going to talk about how she incorporated simulation into her program to increase student competence. And Laura was really hoping to join us live, but I'm sure as many of you can sympathize, they have a very busy sim schedule this time of year. It is, I know for all of you, also really valuable time. So we will have Laura's contact information. She's really happy for people to reach out with any questions. I've also worked with her quite a bit and can chat with people in the chat about what things that she shares and says. But then after Laura finishes sharing her journey for competency-based simulation here, we'll walk through some specific examples of how you could do that with Laerdal's solutions. I am very excited to have Dr. Laura Klenke-Borgmann join us today. So thank you, Laura, for giving us some time. Can you just maybe introduce yourself and share a little brief overview about the program that you are in charge of?
Sure, absolutely. So, hello, nice to be here with you, Amy. I'm Dr. Laura Klenke-Borgmann. I am the Director of Simulation Education and Clinical Associate Professor at the University of Kansas School of Nursing. In my director role, I oversee our simulation program and our simulation curriculum that includes both undergrad pre-licensure students and also graduate D&P students. So I see kind of students on both sides of graduation.
A mighty big program you have there.
Yes.
So I know we're really going to talk about your experience with competency-based education and some specific solutions that you've used to help develop your students specifically in the simulation labs, of course, but also across the program. So what specific challenges or programs did you identify when you started this shift to CBE or competency-based education within your curriculum at Kansas there?
Sure. So I'll start by saying the thing that I really loved about it and the reason that I really wanted to change and pivot our focus a little bit was in the true spirit of competency-based education. I love this idea of it's competency-based education is more about the output that our students can show us and what they can actually do. And how the focus and the importance is so much more on that than the input, just what we tell them, what we teach them, what we say our objectives are. So I think we know that, you know, this big gap that we know exists between academics and practice. I think one of the ways we can close that gap is through not just focusing on what we told them, but what they're actually able to show us. And so I'll just preface my answer to your question by saying that's why I'm so excited about it, is because it's about what they can do and what they can show us. That being said, in the true spirit of competency-based education, one of the sort of challenges or problems was getting over, not just for myself, but for the students and faculty, getting over this traditional way of thinking about learning and about evaluations as for a grade, right? Good, bad, pass, fail. I got a 97%. I got a 73%. With competency-based education, it's more about what you can do and what you can show us and how many times it may take you to be able to show us or do. May be an iterative process, and it may be a different pace than the student to your right or the student to your left. And that can be really, really difficult for students to understand, since that's not how they've been evaluated since, like, I don't know, kindergarten. And also it's hard for faculty to kind of wrap their head around that thought as well.
Yeah, I think that's so true. It's a big shift, not just in how we teach, but also in how our students learn and receive their
Yes.
feedback and assessment.
Yes.
And so it's a big change for everyone. And so how do you get them all on board is kind of that $1 million question, which
That's right.
I know.
And a grade has been such the currency for students' motivation, even for them to sort of study or practice or how they're going to perform has, unfortunately, for better or for worse, sometimes it's been their motivation is getting that grade. And so without the grade, it's hard for them to wrap their head around, well, what's my motivation and what am I supposed to accomplish,
Yeah, we have to really show them what that means. So
Right.
I know you've been doing a lot of work with a sim zone based approach to
Mhm.
transitioning your sim program. And can you just explain a little bit how you implemented that and then how you scaffolded some different learning modalities to enhance the learning outcomes?
Sure, absolutely. So, for those of the listeners who may not be as familiar with sim zones, it's a organizational sort of scaffolded framework by initially by Rusin and Weinstock that basically is a framework for how to sort of plan and scaffold a longitudinal simulation program to get to some type of competency-based output at the end of the framework, if you will. And it basically consists of 5 zones. Zone 0 is basically saying that learners have to have, before they can show us or do really anything, they have to have that baseline foundational requisite knowledge. So that's kind of what the framework of Zone 0 basically is that we know students have to come to an experiential learning experience with some type of baseline requisite knowledge, let's say from classwork or automated feedback that they've gotten from maybe a virtual sim or something like that. Then once the students have sort of achieved that level, the framework says that you move the learner to zone 1, which is just basically as we think of as sort of deliberate practice. So deliberate practice of psychomotor skills, not really context-based, just practice, practice, practice of, let's say, giving an IV push medication or hanging some IV fluids. So that's zone 1. Zone 2 takes the learner up to another level where now they're practicing those psychomotor skills that they sort of did in zone 1, but now in a context-based format. So maybe it's not just coming into the lab and practicing deliberate practice of psychomotor skills, but now they're doing those skills in the context of a case. So more like a simulation, right? But now that because it's contextual and it's still coaching, they can stop and start the sim, they can ask questions, they can get feedback from the faculty or from their peers, and it's like a sim, but it's more contextual. Then once we're sort of accomplished in level 2, we can take them up to zone 3. And that is what people would think of as more of a traditional simulation where they get pre-briefed, they do a sim, they don't get stopped no matter what happens, and then we debrief them afterward. So that's zone 3, essentially. And then zone 4, it really isn't simulation at all. It's them actually taking all of that knowledge and all those leveled experiences and taking now that into practice and actually doing in the clinical setting. So that's just kind of a really brief explanation of sim zones. When I first learned about it, I was like, yes, that's it. It's the organizational framework for which we know we have to move our students, but it's just so wonderful to have it laid out step by step like that for us to kind of start to scaffold and organize our own experiences for our students and ensuring that we've moved them through the right levels and not just throw them into something that A, they're not ready for, and B, we haven't ensured that we've set them up for success.
I think that's so important what you just said, that they're not ready for it. And I think sometimes that's where we see that cognitive overload is when
Yes,
students are thrown into a sim that they maybe don't have some of that practice, practice in level 1
that's right.
or 2, where they've really gotten the exposure and they feel comfortable to then put it all together.
That's
So
right.
giving that feedback and coaching and laying a nice foundation with opportunities to practice, as we know AACN has really advocated for,
Yes.
is
Right.
going to be so important. So I know when
Yeah.
you and I had chatted before, you had a specific senior level course that
Yeah.
you were recognizing students weren't quite ready for that traditional sim. So I wonder if you can talk through that experience of uncovering that challenge and then how you kind of use this approach and some simulation activities to rectify that for your students.
Yeah, for sure. Absolutely. So here at the University of Kansas School of Nursing, at the very end of program for our senior level nursing students in their very last semester, for quite some time, there has been a multi-patient simulation as part of the curriculum, truly at the end of the program as they're transitioning out to graduation. And whenever I took over as the director, I noticed that, I mean, the sim is great. Like I will clearly say the simulation is very well designed. It's very thought out. The faculty do an amazing job at it, but goodness, the students were struggling. They were really struggling with putting all the pieces together, right? Of delegation, prioritization, remembering all of their psychomotor skills from the entire program, putting it all together, managing interruptions. Like it was hard. They were really struggling with it. And so in that first year in my position as the director, I was thinking, there's got to be a better way that we can set them up for success, right? We have to think of a better, more intentional, more scaffolded, backward designed approach to set them up better for this end of program simulation. And so that's where SimZones came in. I thought, if we can sort of work backward and start at the beginning of the semester with intentionally preparing them and moving through those zones of sim zones to get them ready for that very intense, overwhelming kind of multi-patient simulation, I think we can use that sim zones approach as our organizational approach. And so that's exactly what we did. We ensured that we kind of started with zone 0. We knew what the end product was going to be. We knew in zone 3, we wanted them to be able to perform this simulation in this in-person multi-patient sim. So we thought we worked backwards. So we ensured that in zone 0, as students started their end of their last semester, that they had the requisite knowledge to do so, right? So ensuring with faculty and the courses that they were taking that semester, that requisite knowledge would be there as their foundation. So we ensured that was there. Then for the psychomotor aspect of the skills that they were going to be asked to do and required to do in the multi-patient simulation, we scheduled and designed into the curriculum a multi-patient sim lab day. So this is zone 1, right? This is the deliberate practice of those psychomotor skills, where we intentionally created a lab session for them to practice skills that they will be required to do in multi-patient sim. So central line dressing changes is one of them, nasogastric tube placement, IV push medications, wet to dry dressing changes. So these are all things that we knew they were going to have to do and that they were struggling with in multi-patient sim, because some of it has been a while since they've done it, if they didn't get opportunities to do it in clinical or whatever. So that was our zone 1, was this multi-patient sim skills day lab. And then once they kind of got that deliberate practice of those psychomotor skills, we moved them up into zone 2, which is more of the contextual learning, but still being able to stop, start, and ask questions. And that is where vrClinicals came in. Because we knew, sure, they had the psychomotor practice of the skills in zone 1, but we still wanted them to get some great contextual prep with the cognitive skills that would be required in the deliberate practice or in the multi-patient sim. So vrClinicals was fantastic for that, because in the VR medium, they were able to practice those those cognitive skills of prioritization, delegation, deciding what patient they're going to go see first and why, managing interruptions, managing, unexpected things that pop up throughout the scenarios. And so we felt that putting vrClinicals in that zone 2 was a great bridge, if you will, between zone 1 cognitive, or I keep saying cognitive, zone 1 psychomotor skills, and then actually getting them ready for putting it all together in an in-person multi-patient sim. So the multi-patient vrClinicals was a great bridge to bridge the psychomotor skills, the cognitive skills, and put it all together for that zone 3 in-person multi-patient sim.
Awesome. And, I think it's such a unique solution, the vrClinicals for nursing, because it does give that contextual experience, like you said, because it's hard to understand, when interruptions come up and you're with one patient, do you leave and go to another patient? Or, when there's another patient that has a change in status, how does that affect the care of the other 3 patients that you're in charge of taking
That's
care
right.
of. And so
That's right.
students don't get a lot of exposure to that, to give them just the one experience at the end of the semester, which is, I think, pretty common across a lot of nursing programs, without the ability to practice and have that exposure and context is challenged. And I think that's,
Yeah.
what you said you saw. And I'm really excited to hear that that's a solution in a way that you've scaffolded it, mixing in that psychomotor skill lab as well, to be
Yeah.
sure that they can do this actual skills once they get there.
Yeah.
How have your faculty and your students responded to using vrClinicals in this way, and maybe just to the format as a whole?
Yeah, well, it was in terms of your specific question about vrClinicals, it was definitely a transition for us. It was a big change. It was the first time we really, in earnest, have incorporated intentionally VR into our sim curriculum here. So, certainly there was a learning curve for myself and the faculty who were going to be leading those.
Yeah.
And it was a learning curve for the students as well. It was interesting. We kind of made the assumption, myself and the faculty involved, that that students were, how it is with we as faculty think, oh, the students are like so much more evolved than us in terms of the technology. And certainly there were students who were, but there were still a lot of students who truly needed the hands-on practice time, the orientation, the tutorials, even more so than maybe I sort of expected. That they weren't just like all gamers that just like jumped in and knew exactly what to do, So the tutorials and the orientation that the vrClinicals provided was definitely helpful and needed for us and also the students, because you want the experience to be about the learning and about them making their decisions and all of those cognitive skills that I mentioned, the delegations, the prioritizations, not troubleshooting the tech, right? And so yeah, we wanted the objectives to actually be able to get accomplished, not spend the whole time troubleshooting the tech or explaining them how to work the hand controls and things like that. So I'll definitely say the tutorials and the orientation that come with vrClinicals was a huge asset in that respect, in sort of onboarding and getting everybody up to the same level and the same speed to actually then be able to jump into the learning. So I'll definitely say
Feel
that.
about the actual content and experience of being in once they were comfortable?
Yeah, no, I think they really did enjoy it. And like I said, for a lot of students, it was a new experience for them, which they liked. Like they liked that novel aspect of ways to practice, as you said, things that they're not necessarily always getting an opportunity to do in practice or in clinical or even in simulation all the time, to be able to be in that immersed environment where, I had so many students say as we were debriefing afterward, like, it's just so hard to know where to start. Like, I can't tell you how many times students said, like, I just kind of got into it and got on the unit and was like, what do I do?
I go.
I know, where do I
Yeah.
go? Who do I see first? How do I even get started? And so I think that is a huge value to this particular product, is that realism of sometimes we know that new grads feel that sort of, paralysis by analysis of like, I don't even know where to start. I'm overthinking all these things and I'm thinking through things and I don't even know like how to begin. And that came out loud and clear a lot in the debriefs after our VR sessions, of that was really good for them to be able to have that experience of like, oh wow, it's just me now and I have to make a decision and I have to start. So they really enjoy that realism aspect of just starting on the unit and let's go.
Report and go see 4 patients. Yeah.
That's right. Yeah.
That's wonderful. And how have your faculty and students responded to the complete scaffolded approach? Are you seeing some better outcomes in that
Yeah.
multi-patient sim now?
Yeah, we are. So in the multi-patient sim, we have been, and again, we're not done yet because the semester is still going on. So we don't have like all the finalized data, but we are collecting some data from the multi-patient sim. Specifically, we have a competency checklist that we're sort of being able to evaluate the students on. That includes sort of the competencies that we're looking for. So obviously the basic things like doing a good assessment, hand hygiene and safety, doing the 6 rights when they give a med, communication with the patient, clinical judgment, but then also looking more at some of those skills that are higher level, because it is the end of the program. So prioritization skills, management of interruptions, things like that. So we're collecting that data. The other thing that would be, I want to make sure that I share because I think this is particularly interesting, is we also collect data on the students when they're done in the multi-patient sim experience on their cognitive load.
Oh, wow.
So
Yeah.
we use the NASA TLX tool. I don't know if people or some people may be interested or familiar with that. Others may not be, but it basically is a valid and reliable measure of cognitive the participant's experience and perspective of cognitive load. And it asks specific questions regarding like temporal load, like how rushed in terms of time they felt, physical load, like how actually tasking or physical their load felt, obviously cognitive load, and then some other things that it measures just by like on a Likert scale, it asks them to fill that out. We actually had the students fill that out in last year's cohort, and now we're having the students fill it out in this cohort to see if there's a difference in their cognitive load now that this cohort has gone through this scaffolded approach of preparing them better for that multi-patient sim. And so we'll be really interested to see the final data of that, to see whether or not their cognitive load is diminished based on this intentional prep that we've done for them. The other thing that I will say is that I think students have appreciated about the inclusion of VR into this scaffolded approach is that it is truly now, because we've included VR, it is truly a multimodal scaffolded approach. So, you know, like I said, in zone 1, we're talking about psychomotor, deliberate practice. In zone 2, we are doing VR. And also, by the way, I didn't mention, I mentioned that they have 2 different VR sessions that they do like a week apart in zone 2. One of them is the 3-person 3-patient one, and then we level them up the next week when they come back to the 4-person. So we even scaffolded the VR clinical into that approach. And then in the actual multi-patient sim, they have standardized patients, playing patients, and we have high fidelity mannequins. So it's a mix of different types of patients in the multi-patient sim. So truly, from beginning of the process to the end, we basically have hit all the modes of simulation there can be
I think what you've
from
done
all
though
those
is
zones.
really, you know, capitalize on the learning outcomes. You know, there's things
Yeah.
that mannequins can do, and there's things that standardized patients can do. There's things
That's
that
right.
VR can afford you, and there's things
Yeah.
that, you know, old task trainers can still afford you as well.
Yeah,
And so
right.
when you're looking at what is the outcome we're trying to meet, it's so important to match that modality to outcome. And so
That's right.
finding solutions, mixing solutions like you've done, I think is just a really beautiful picture that you don't have just one thing, because you
That's
really
right.
need a variety, not only to tap into different learners and to different students, but you know, this is a senior level course where students probably can have some autonomy to say, come to lab and practice these skills.
That's
You
right.
don't need to have, you know, a faculty station. They've done these before, but you have somebody
right.
there to assist and to help. And then the VR really gives them that scaffolding within the solution as well, you know, support when needed, more complicated scenarios as needed. And then, like you said, the 2, 3, or 4 patient experience, depending on what they're ready for. And you can
Yeah.
keep increasing that cognitive load as
Yes.
they show that they're ready for it, which I think is really
Yes.
cool. So
Yeah.
it's
Yeah.
just such a neat example of how you've utilized simulation to scaffold learning and really build towards competence of your students. And I hope you all are feeling really proud of yourselves. And I
Well,
can't wait to
thanks.
see the data,
Yeah, me too.
of course. So I think everyone should keep posted, of course. I know that Laura has published an article on her SimZones approach, and we'll be sure to share the link in the chat, and also the podcast with the National League for Nursing,
Yeah.
the Edge Unscripted. So we'll share the link to that as well in case people are looking to learn more. So
Yeah.
I just want to thank you for your time. And if there are any questions, is it okay if folks reach out to you and we share your email address?
Oh, sure. Absolutely. Share my email address. I'm also pretty active on LinkedIn, so you can definitely
Yes.
find me there too. So.
Yes, you are. You're a busy, busy person.
Thank you. I want to thank Laura for sharing her insights and enthusiasm for CBE and simulation. Her passion is contagious and truly inspiring. And we will share her information later in the presentation. And so I really appreciate her focus on the sim zones as a method for supporting her students in meeting their outcomes through that backwards designed approach. And Laura provided an excellent example on how her program scaffolded in learning experiences to effectively prepare her students for managing multiple patients. And so as we move forward in our presentation, Amy and I will demonstrate how Laerdal solutions can improve the support you offer your students in their competency development. So let's dive into a practical example that illustrates the different phases of this learning pathway. So imagine a nursing instructor is tasked to teach IV fluid management. This is a critical skill that we know nursing students need. In the classroom, zone 0, the instructor begins to discuss IV fluid types, the reasons IV fluid therapy may be needed, how to calculate rates, and the importance of monitoring fluid balance. This foundational knowledge aligns with competency-based education principles and then sets that stage for hands-on practice. So after learning the content, the students will advance to the lab to practice those IV fluid skills with their peers using SimCapture and the modular trainers. As they work together, the students offer constructive feedback for assessing patient needs, and then start IVs and calculate that drip rate. And they're able to administer those IV fluids. And with SimCapture, the instructor is able to observe these interactions and collect individual and group performance data, helping identify concepts that may require reinforcements at that group level, as well as pinpointing students who need that extra support before evaluation. This hands-on practice not only hones those technical skills, but also cultivates some of those vital soft skills such as communication and teamwork. And in line with CBE principles, the Modular Skills Trainer, or MSTs, and task trainers empower students to practice independently. They can use SimCapture self-record to film themselves inserting IVs or managing IV fluids, allowing them to review their performance and identify those areas for improvement, and then they can re-record until they feel confident. This approach encourages that deliberate practice and ownership of their learning. And the instructor can review these recordings and provide constructive feedback and to help with enhancing those techniques. And so now let's look at our screen and what some of the different products that we have that I had mentioned. So you can see the MSTs at the bottom and then one of our IV task trainers up above. MSTs were developed to allow students to practice up to 16 different skills within one trainer. The modular design lets learners swap out the different components to train on various skills as needed, whether they're at home, in the lab, in clinical, in the classroom setting. And Laerdal also offers various task trainers and solutions to help students build those foundational skills to advance their competence. And on the right, you can see screenshots of SimCapture. This platform facilitates skills practice through peer-to-peer approaches, enabling students to evaluate each other, or they can also practice independently. And all that data is collected through SimCapture for real-time feedback and faculty tracking. And now that we've discussed a little bit of the hands-on practice with IV fluids and the benefits of the modular skills trainer and SimCapture, let's dive a little bit deeper into how SimCapture enhances quality training and streamlining those operations in your center. By consolidating multiple processes into a single platform that is web-based, SimCapture facilitates efficient workflows while collecting vital utilization and performance data. Think of it as like a comprehensive LMS system for managing your operations and curriculum and simulation. So SimCapture empowers CBE by enabling real-time recording and debriefing of simulation experiences, ensuring that every session is a meaningful learning opportunity. And its standardized assessments promotes that reliability and efficiency, while features like peer-to-peer practice and self-record encourages active learning from our students. And with detailed analytics, SimCapture provides those insights on individual learner performances, allowing instructors to tailor training to meet those specific needs, as well as identify areas for course and program improvements.
Thanks, Erin. I almost made the classic forget to unmute mistake there. Sorry. Thank you. So building on that example that Erin was kind of talking through, Laura mentioned that backwards design approach, and our end goal here was building IV fluid management. And so students got that foundational knowledge in a class. They then practiced on their own or with a group or with a faculty. And now they're really need to also understand the patient assessments, the contraindications or the indications for fluids. And vSim for Nursing is a great place to really practice that and enhance their decision-making skills. It was co-developed by Wolters Kluwer, Laerdal Medical, and the National League for Nursing. And it really provides students with those learning experiences to develop clinical judgment and decision-making skills. Laura talked about the ability for students to be independent in the VR solution that she is employing. And this is also similar to that in the sense that students can pause, they can look up more information, they can get report before they begin, and really be sure that they have that requisite knowledge before they move into these scenarios. The new clinical judgment exercises help the students to be informed from their first actions, so they know that they understand the plan of care moving forward, and then they really walk through all the steps of the clinical judgment process in order to see, can they care for that specific type of patient? If I had been educating on IV fluids and looking at vSim as an assignment, I might think about having two different patients who have really different IV fluid needs, right? And then have our students compare and contrast the similarities and differences in caring for those kinds of patients. So how does IV fluid management impact patient care in a pre-op setting, in ensuring that you have that hemodynamic stability moving into the OR and in the post-op setting, versus when a patient comes in and is unstable, perhaps using the dehydration or hypovolemic shock patients that are available in vSim for nursing. And so being able to have those multiple contexts of care is something we're hearing a lot about, especially from AACN and NLN as well, in the sense that we want students to be able to understand how their care is different and similar with different patient demographics, with different care settings. And vSim for nursing really allows for you to help students see how that changes from one to the other with that same type of concept threaded underneath. And then just like Laura had talked about, if I were continuing my lesson plan there, I might think about leveraging the vrClinicals. Sorry, I'll have you go to the next slide, Helen. Thank you. And might move into vrClinicals for nursing, which is also a solution that was developed with Wolters Kluwer and the National League for Nursing and Laerdal. But this really gives them that ability to practice, like Laura emphasized, that horizontal prioritization between patients. So what happens when patients have a change in status? What happens when there's interruptions in care? But then you also can thread through those concepts, which are woven throughout all of these patient cases of, when a IV medication comes up and they how does a student decide what takes priority of staying with a patient who's maybe having an acute event versus medications being due? How do you delegate? How do you utilize your team to ensure that your patients are staying safe? And then how do you also know when you need to prioritize one patient above the other, especially when it comes to medication or fluid in this type of example? And that prioritization between patients is really hard to replicate, as I'm sure everyone on this call appreciates. And it's often undereducated in real meaningful ways. And we've found that through the National League for Nursing's research when this product was being developed. They really found that students struggle in that transition to practice, particularly when it comes to managing multiple patients, handling interruptions in care, and changes in status. And so vrClinicals for nursing gives you that ability to embed those principles and those outcomes or competencies throughout 3 different levels of your program. There's a beginner, intermediate, and advanced level, all with 2, 3, or 4 patient interactions. And so students really get that sense of seeing their competencies develop in, a leveled approach that's appropriate to them. And then faculty are provided with all the curriculum resources of how do you effectively integrate this into your program, and then how do you debrief a scenario that you yourself are maybe not immersed in. And so this is, this is a solution that's within the headset, so students are in the environment, they're immersed themselves, but this is meant to be student-driven and autonomous. And then for vSim and vrClinicals, we recognize the need for that individualized and immediate feedback, which is so important to success in competency-based education. And so for both solutions, you'll get different detailed feedback and remediation support for learner development and progress, with links to the best practice and rationale for interventions. Helen, I think you can advance one, sorry. Yep, and so you'll get these overarching scores, and then you'll also get, on the next click there, sorry, kind of a breakdown of, what were the critical steps that students did or did not take, and which things should they maybe have to focus on, again, with that rationale and expert responses. And then when you move into vrClinicals, you also get a little bit more understanding and rationale for how students should prioritize between patients, so that students can start to build that understanding as they move into more of those experiences. The nice thing that I like about seeing the tips of, where can students improve is they really get that ability also to go back and replay that scenario if they want. I know most of us would love to be able to redo our simulations in person as much as we can, but sometimes we have real-time constraints around that. We don't get that. And so the virtual environments, whether it's screen-based or virtual reality, really affords you that ability to, finish a scenario, see what you could have improved on, go back and do it again, and really solidify in that deliberate practice or mastery of knowledge way.
Thank you, Amy. I know I love that ability to just practice it again and again and again until you get it right and see where you can improve, which is one of those things to where RQI assists with that as well. So RQI, which is resuscitation quality for nursing, quality improvement for nursing, is a competency-driven solution that allows students to independently practice their CPR knowledge and skills. And while RQI may not be directly related to IV fluid management, it addresses a critical foundational skill that is required by all healthcare providers. And it's important that we review RQI as a competency-based solution. As we know, every nursing program requires CPR certification for its student. And as we also know, traditional methods of teaching BLS does not support that skill maintenance or allow for that frequent practice for those novice nurses. RQI requires students to complete an adaptive online module as a knowledge check, and then after that, they can autonomously practice and improve their competence at regular intervals throughout the program by utilizing a simulation station. This station provides real-time audiovisual guidance and feedback for reinforcing their learning. And faculty are provided with performance records to ensure that their students have been complying with their training. And so as we move forward in the Sim Zones pathway, we're going to shift from that independent practice to more collaborative team learning and that role playing that is you see more in Sim Zone 3. High fidelity simulation creates that realistic environment where students can experience that time pressure and that teamwork, all in that safe space where they can practice, make mistakes, and grow through this experience. And so during a realistic simulation scenario that focuses on that IV fluid management, students can first access the EMR in SimCapture to review the patient's information, including their orders, their labs, medications, and their medical history. And equipped with this knowledge, they can then start their scenario and make informed decisions while providing patient care. Peers are able to observe live recordings from another room, and the instructor conducts formative evaluations at both the individual and team performance. And after delivering care, the participants document their actions in the EMR, reinforcing that importance of accurate record keeping. And following the experience, the students and faculty engage in debriefing sessions, reviewing their recordings to assess their skills and their clinical judgment that they exhibited during the simulation. And the students then complete NCLEX style questions related to their scenario and provide feedback forms through SimCapture, which the program then can use to enhance for future experiences. The final step of our IV story today involves the instructor providing that formative feedback based on individual and team evaluation, highlighting both the strengths and areas for improvement. This comprehensive approach assesses their competencies in IV fluid management and is preparing them for that real-world application. By leveraging evaluation and practice tools in SimCapture, educators gain that valuable data-driven insight into student progress. This enables that real-time intervention and adjustment to instructions as we see needed, as well as personalized support tailored to the individual learner. SimCapture captures a wide range of data points that reflect student competencies and development over time, facilitating timely and constructive feedback, creating that essential feedback loop for that continuous growth with our students. Additionally, the platform encourages self-directed learning by offering structured opportunities for the students to take ownership of their educational journey. Through this integrated process, SimCapture supports competency-based education by providing a framework for structured learning, assessment, real-time feedback, and those pathways for self-directed growth, effectively scaffolding the students' development and ensuring that they are equipped to excel in their nursing career.
So man, we have gone through a lot of content with Laura and a lot of solutions with Erin and I just want to kind of recap and level set here, that when we think about how to achieve competency-based education in nursing, I think Laura said it really nicely. You want to start with that outcome and work backwards of what you're hoping to achieve. And so, even in our own example, we wanted to be sure to touch on some of those competency-based solutions that we have through Laerdal, because they might help to solve some gaps that you have or some goals that you're looking to achieve. But they can be used in all sorts of different ways. I think the example from University of Kansas is so nice to see that, they recognize students are struggling with a sim that they had created and have been running for quite some time. And so how can they more effectively use the other modalities that they either had or knew were available in the market in order to support their learners? They didn't really change, the ultimate goal. Their goal is still for their senior level students to be proficient and capable at caring for multiple patients, but they knew that they had more modalities to support their students to get there. And it didn't necessarily mean that, faculty had to change their curriculum and they had to change the way that they teach, but it really was about giving different supportive resources within those learning experiences so that students got the ability to practice more, to demonstrate their skill, and to be a bit autonomous in how they decide or how they develop decision making within the goals that they had for that semester. And so starting with that outcome can look however it is for your program. It can seem daunting to think of the end program goals, but, one course at a time is a nice way to think about it. And then really like I said, scaffolding those experiences. So the Sim Zones approach that Laura shared and that I think we put some information in the chat already about is a nice model, but it might not work for everyone's programs. And so finding a model that works for you, but it's really about matching the outcome to the modality. And so, if you're trying to work on just placing the IV, a high fidelity sim is probably not the best way to teach that. And so matching that with the task trainer or, whatever that would be. And then really utilizing the performance-based assessments. I think this is something we have a lot of room to expand on in nursing education. And I'm grateful that Erin, you could share just like 2 seconds of those clips of SimCapture. And, we'll both be share our contact if you have more information. But I think the difference here is that we're looking at those performance-based assessments and not just saying, great, they're here and done, but it's what do we do with that information? So taking that data from SimCapture and saying, my students performed this way in the assessments or in the simulation per the assessment that I did, what other resources could I give them to help strengthen areas where they're weak or challenge them in areas where they're already excelling? So I think it's nice to look at it in both views and then also to look at it from a programmatic approach. Where is our program really struggling? It seems like all the students are having issues with this same concept. Let's go back as a group and look at it. And I know we do that for testing and we do that for assignments, but really using that data from simulation and from clinical will be just as powerful in your programs. Did you have a comment to that, Erin? I saw you come off mute.
I know, it's just one of those things with getting to where I'm so passionate about that, with looking at assessments in simulation, and with it, like we're able to see, like you said, overall, are there certain elements that we're evaluating that are showing challenges, and with aligning to what you see in the classroom environment, with looking at item analysis that you do for test items, being able to do that in simulation as well, so that you can see where our students are doing, but also identify with our evaluations where there might be gaps that we could improve how it's written, so that way we have that standardized ability as well as some of that inter-rater consistency. So once again, it's just getting back to improving what we do.
And so taking those great simulations you already have and then making them even better through those performance-based assessments will be very powerful in getting your students to develop that competence and see it develop throughout your program. And the last piece I just like to really talk about too, that I think you've seen throughout all the solutions we've presented today and from what Laura shared as well, is that continuous feedback for learners and faculty. And so, after each learning opportunity, whether that was in the skills lab or it's in the virtual environment, they can get that detailed report. They can get information about how did they perform as an individual, as a group, and really start to understand where do they have opportunities before they get to that final outcome of your course, whether that's a simulation or a clinical performance or a clinical observation. It helps students to really start to see, I'm not just doing this vSim to check a box because you assigned it to me on Tuesday and I have to finish it by Wednesday. I'm doing it because you want me to see the difference in caring for this patient versus that patient, or in really understanding how my decision making affects this type of patient in this context of care. So I think that continuous and timely feedback is great for students to be able to read it right away, make an impact and have that deliberate practice.
So yeah, thank you all for presenting. That was fantastic, and the dialogue in the chat has been excellent as well. So while we have you, we wanted to take a moment to actually share the next webinar in the series. This is a part of a webinar series. This is the first, and so the second webinar will be focused on navigating CBE in healthcare, and it's going to be held on May 6th at 2 p.m. Eastern. We're very pleased to have speakers from the Society of Simulation in Healthcare Simulation Grounded Competency-Based Education Task Force. That is a mouthful, and Affinity Group. And so we'll have the leadership team from that. So Dr. Curtis Nickel from the University of Ottawa and the Ottawa Hospital, Dr. Marie Gilbert from Central California Center for Excellence in Nursing, and Dr. Brian Mann from the Philadelphia College of Osteopathic Medicine. And of course, we're going to have our very own Amy Klein, who you all have seen today. So during this webinar, we will discuss how simulation fits into the larger context of CBE. We will share how programs can integrate simulation at a program level, and we will analyze the challenges and opportunities of using simulation for competency-based assessment. So please use that QR code there and scan it, and you will get registered at that point. And we also are going to be dropping a link into the chat. I'm sorry if you heard my dog bark.
Can I just say too that these, like you said, these are people from the Society for Simulation and Healthcare Task Force on CBE, and they're hoping to really show some practical strategies. Dr. Curtis Nickel and Dr. Brian Mann both work in competency-based medical education and have a lot of lived and learned experiences, especially when it relates to assessments from simulation. So I hope you find it really helpful and informative and are able to join us. They'll be sharing how they've done it and what you can learn from them.
Excellent. Thanks, Amy. So before we actually wrap up the webinar, I'd like to take a moment to share a little bit more about Laerdal and about our company's mission. In 2020, we set a bold goal, helping to save 1 million more lives every year by 2030. It's a goal we share across all of our companies, and it continues to guide and inspire our work that we do every single day. The word helping really matters. We do not save lives. First responders, midwives, nurses, doctors, and bystanders do. Our role is to support those who train and equip them to do it even better. We are pleased to share some highlights from our progress. The first highlight is that over 15 million bystanders have been trained in CPR through gamified and digital solutions, including 200,000 soccer fans at the UEFA 2024. Additionally, 2 million providers have maintained their CPR skills through the RQI program that Erin mentioned earlier, helping save an estimated 8,000 lives a year. And there's also been a 75% drop in maternal deaths and 40% reduction in early newborn deaths in Tanzania through the Safer Births Bundle of Care program. And we've made a big pledge to help scale the WHO's Basic Emergency Care program that may reduce mortality from injury and sepsis by 50% and lead to 50,000 more lives saved in the next 3 years. If you'd like to learn more about this or about our mission, or read our 2025 impact report, please visit the URL that's at the bottom of your screen. And that brings us to the end. So again, I'd like to thank our wonderful speakers, Laura, Amy, and Erin, and thank you all, the audience, for joining us today. We'll see you on May 6th for that next CBE and healthcare webinar that we mentioned. Take care, everyone.